Losing a loved one during the pandemic presents many challenges. My father-in-law passed away on July 16th, 2020. And we know that the pandemic and the implications of the pandemic contributed to his decline and his deterioration and an earlier death than he might have otherwise had. He lived with us for about 6.5 years. And in the fall of 2019, we placed him in a retirement residence where he could get more consistent care throughout the day and night. And when he was there, he stabilized, he was happy, he gained some weight, he was enjoying his meals in the dining room, especially having dessert for lunch and dinner every day. He was enjoying companionship and generally better care. And so we knew that with his diagnosis of dementia and with a heart condition that would continue to deteriorate over time, we knew that his time was coming. But we also believed he was in a good place where he would be well and be with us longer. When the pandemic restrictions happened in March of 2020, the retirement residents very rightly followed all the recommendations, which meant that we could no longer visit him. We'd been going in and visiting him almost every day to help with small tasks and just be present, be company for him. And suddenly we couldn't be there. And suddenly he wasn't able to eat in the dining room anymore. They were being served their delicious meals alone in the rooms. And the staff was stretched to try and spend time with each resident to give them some companionship because visitors weren't allowed, and they weren't allowed to socialize with each other in trying to protect them from the spread of COVID-19. We still kept contact with him by daily phone calls, but we could hear over time the impact that the isolation was having on him. He began to hallucinate more often. His delusions increased. He was very distressed that we weren't coming in to see him in person. He often asked us to come in and help him with something. And in times he would think that someone had visited. He would hallucinate that someone was visiting him, and he would be quite distressed and upset with us that we were not also visiting him. So it was a real challenge to try and support him and help him understand as we went through that process. And even though we know all of the things that were being done were for everyone's well-being, it's hard to know that the pandemic restrictions also meant probably a more rapid decline and a sooner end of life for him as a result.